Thank you, Madam Chairman. Bismillahir Rahmanir Rahim. With the name of Allah, most merciful and benevolent. Namaduhu nasalli ala rasulihil kareem amma ba'd. Assalamu alaikum and good afternoon, ladies and gentlemen. I'm going to talk to you about inflammatory myopathies. This is actually a heterogeneous group of disorders which is characterized by... How does this work? Excuse me, can you help me with the pointer? The pointer. Okay. So, this is characterized by symmetrical proximal muscle weakness, elevated muscle enzymes, typical EMG findings, and muscle biopsy, which is suggesting inflammation. Now, all of these, when present, we term it as polymyositis, and when along with all of these, we have a characteristic skin rash as well, then it is known as dermatomyositis, and when we tend to have all of this in the pediatric age group, it is then called juvenile dermatomyositis. And there is yet another entity that we encountered in the elderly population, and it is known as inclusion body myositis. The prevalence is about 1 in 100,000. Estimated annual incidence is that of 1.9 to 7.7 per million persons. Women are affected twice as commonly as males, and the peak age of onset tends to be around 40 to 45 years. The etiology, there are lots of postulations regarding the etiology, and various genetic factors have been incriminated. The genes belonging to the major histocompatibility complex, some of them they are like triggers for the disease, whereas some offer a kind of a protection from the disease. And then we have a lot of environmental factors which are sort of triggering the disease. In this we have infective as well as non-infective causes. The presentation of the disease is a very, very insidious onset of progressive muscle weakness. Mostly the proximal musculature is involved, and the patient starts to have, problems with activities of daily life, like climbing stairs, getting up from the sitting posture, and later on the arm muscles might be involved when he might have problem combing his hair, reaching out for things kept higher up in shelves, etc. The fine motor skills tend to be affected much later on in the disease, but are commonly seen earlier in this variety, the inclusion body myositis. Sensations are preserved, the ocular muscles and the facial muscles are almost always preserved, 10 reflexes are preserved, and 1/3 of these cases tend to be associated with various other connective tissue disorders, and 1/10 may be associated with malignancies. There are also a lot of systemic, other, extramuscular features present. The systemic variety, we have fever, malaise, weight loss, arthralgias, Raynaud's phenomenon. Then cardiac involvement might be there, in which we have conduction disturbances, tachyarrhythmias. The respiratory involvement is very important, and especially this entity ILD is something that we really need to look out for. And then with the involvement of the diaphragmatic and intercostal musculature, there starts to be, weakness and shortness of breath, and then alveolitis can also be there. However, this is a relatively more treatment-responsive condition. We can also have joint involvement, in which we may have arthralgias or arthritis. They tend to occur early in the disease. The arthritis is rheumatoid-like in distribution, and they are more commonly met with in the overlap syndromes and in childhood dermatomyositis. A diagnosis is usually made on the typical clinical picture, supported by raised muscle enzymes, characteristic findings on the EMG, and of course, the muscle biopsy is the gold standard. So depending on the variant clinical picture, we have got certain subsets of the disease, and the first one is polymyositis, and then we have dermatomyositis, then there are myositis associated with other collagen vascular diseases, then there is a myositis which is associated with neoplasms, and then there is juvenile dermatomyositis, and finally inclusion body myositis. A few words about primary idiopathic polymyositis. About 1/3 of all cases of inflammatory myopathy belongs to this group, and it is usually symmetrical and proximal,